I'm Sandy Heinrichs, Director of Human Resources at Burnett Medical Center in Grantsburg, Wisconsin. I've been working in human resources for 31 years and in healthcare for almost 7 years. I'd like to share a few, hopefully helpful tips for you.
Hi, my name is Carla Patrick. I am a registered nurse at Allina Health, Cambridge Medical Center. And my role here is in learning and development, which is education, and I also work with community engagement and wellness. And I'm going to be speaking to you today a little bit about interviewing and things to consider when you do go for an interview. I have been in healthcare for 20 years, and in my current position here at Cambridge Medical Center for the last 12 of that.
We have an online application on our website found under Careers. When I look at an application that's not filled out completely, it indicates that the applicant may carry out their job duties the same way. Parts of an application that are blank also may result in you not being considered for a position because we may not know pertinent information such as what shifts you're willing to work. We've received 100 applicants for one position, and we don't have time to call for missing details on all those. So please fill out your applications completely. When you fill out an application on our website, it comes directly to my inbox. If we have a current opening for the position you're applying for, I'll forward it on to the hiring manager. If not, I print it out and file it for openings within the next 12 months. Experience is often a deciding factor as to whether you'll be hired. As an example, an RN would need 6 months acute hospital experience to be hired in our emergency department. We're required to conduct a criminal background check and reference checks for every employee we hire. So how you conduct yourself can influence future job searches. We look for applicants who will treat our patients, residents, and coworkers with respect and have a good attitude. We all have bad days, but your employer expects you as a paid employee to leave your troubles at the door and be professional while you're at work. What I love to see is employees who are passionate about their job, excited to learn and take advantage of training opportunities. Our RNs receive training during staff meetings and several other times during the year. We encourage continuing your education and accommodate revised work schedules.
When interviewing, always be prepared. And I know that I talked about that already, but I'm going to say it again. Be very prepared. When you think of background information and going into your interview, remember that the person that's interviewing you already has your letter and your resume, so they're going to be familiar with you already. They've read it, they've done maybe some research on where you've been, where you're coming from, so they do know that. You might be asked at the beginning of the interview to share a little bit about yourself. This is your time to really hit the high points. So think about and prepare what are those things that are most important for you to get across right away before they start asking other questions. What do you really want them to know? And also think about your background. What is in your background and your experience that would best suit the position that you're interviewing for? Consider anything that you've done in your past, your education, your training, and also volunteer opportunities that might be applicable for the position. Another important thing to consider when you are going for an interview is do your research. Do your research from the minute that you know that you're going to be applying for a position with an organization or a business. This way, if they do contact you at the last minute and say, can you come for an interview this afternoon or tomorrow, you will have already been prepared for this interview. So do that research ahead of time. Be familiar with that company. Visit their website. Most companies and organizations will have their mission statement right on the homepage of their website. Look at their vision statement. What are they hoping to achieve? What are their values? At Allina Health, we have values. And I can tell you that at every interview that we do, we ask our interviewee if they know what our values are, and to mention them if they do know, and we do weave them into the interviewing questions. So being familiar with those values is quite important. Also, you might be asked a question about the size of the organization. How many sites or branches, how many employees does the company employ? Being familiar with that shows that you did do your research. The other thing to be familiar with is the services of the organization. In healthcare, it's important that if you're interviewing for a position, that you know what services are offered at different locations. Whether it's physical therapy, radiology, laboratory, surgery, those types of services are important to know about. The other thing in your research ahead of time is it is completely appropriate to ask for a position description or a job description in advance and to review that. There are many pieces within that job description that you might have questions about, or they might ask you a question about the position description. So at that point, please consider questions that you're going to have, and I'll mention this again later, but write down those questions. It might be pertaining to anything with regard to the position or the duties. The organization itself, it might have to do with your orientation and what you can expect there. Reporting structure. Those are all very appropriate and important questions to ask during the interview. When going for an interview, you might hear the term behavioral interviewing. They're not going to do a psychological assessment on you, but they are going to ask you questions that are based on job-related situations. They're going to ask about specific examples or behaviors or actions that you as the applicant might have done to gauge past performance, past behaviors. For example, there are 4 areas that would be considered behavioral interviewing and questions that would come out of these categories. The first of the 4 is technical. This would be skills to do the job and maybe readiness to learn the new skills. Where are you technically to be able to do this job? The next is problem solving or organization questions. This would be questions that would help find a solution, that would show your creativity, asking the right questions of the right people, being organized with your time and resources to help solve and avoid problems. And the third is questions around customer service. How have you acted with customers in mind? How have you met both internal and external customers' expectations with trust and respect? And the 4th area of questioning could be around teamwork or working with others. This would show your ability to work effectively with diverse populations, with differing points of view, how you can maybe overcome challenges to accomplish tasks, how you might have supported team building and positive morale, and also how maybe you've been trusted and respected amongst members of your team. Here are a few examples of behavioral interviewing questions that you might want to consider before going for your interview. The other thing I would recommend is writing down your responses ahead of time so that you feel more prepared. First would be, describe for me a typical day in your current or last position. What did you like best about your position and why? Next might be, what specific knowledge, skills, or ability do you think XYZ position should have? Next could be, describe a specific change in your current or last position or work situation. How did you respond to that change? Another question might be, share with me a time when you provided excellent customer service. What did you personally do, and how did the customer respond? It's during these questioning times that you might be asked about the values of an organization. Values such as trust, compassion, stewardship, integrity, respect, trust. All of those things perhaps could be woven into a question. They might even ask you what value you identify with personally and why, and how you might bring that to the position. So doing your research ahead of time is very important. Another question might be, describe for me a time when you had to deal with a highly dissatisfied customer. What did you do? Or share with me the best team experience that you've ever had and what made it the best. And lastly, another one might be, give me an example about a time that you had to deal with a difficult coworker. What made them difficult and how did you cope with it? Always be prepared for follow-up questions to whatever answer that you might give. A question such as, would you have changed anything about that encounter? If so, what? And if not, why not? Don't be surprised if the person that's interviewing you is taking notes. That is totally normal, very common. They are just trying to remember some of the key points and answers to the questions that they've been asking you. This doesn't mean that anything is wrong. This is completely normal. It is also perfectly okay for you to take a deep breath and really take your time in answering. A lot of times what I've noticed in interviews is that the interviewee rushes to answer the question, maybe with not even fully thinking about the question or really hearing what the question is. So take a moment, gather your thoughts, take that deep breath, that's totally fine. And if you need to have the interviewer repeat the question, that is also perfectly fine. So just take your time and be really thoughtful in what you're answering. This really shows the interviewer that you are thinking about the question and that you really care about the answer that you're going to give. The other thing that I recommend is having a portfolio notebook with you, something very professional, perhaps with a previous company's logo on it where you previously worked, or even something generic from Office Max, but just something very professional looking that would have a notebook in it. It's important that you have written down some key points on there. It is completely acceptable for you to have written down some brief statistics that you've learned in your research of the company, such as how many employees or how many branches. If you write down the values of the company. All of these things are just fine for you to glance down at to help you remember. The other thing that you can write down is your questions. That's very important. As you prepare for your interview, it is completely fine in your portfolio notebook to jot down some answers to some anticipated questions. I referred to earlier the 4 categories of technical, problem-solving, organization, customer service, and teamwork. If you anticipate some questions, go ahead and just jot down some terms or brief words that will trigger a memory or a story for you, because that's really what your interview is. It's you sharing your past experience, your responses, behaviors, and actions. So writing down those responses is completely fine. The other thing that I mentioned is questions. It's important to have a minimum of 3 questions for the interviewer. This shows that you've done your research, this shows that you've examined the job description or the company, and that you really are interested in the position that you're interviewing for. Now is the time not to ask about wages. I know that this one can be debated a little bit, but in my experience, wages is not something at this time to be discussed. This typically is established once you are offered the position, and at that time you are able to enter into negotiation about wages. You will usually know as you're applying for a position what the range is, but as far as a specific salary range for yourself for this job, that's something to be discussed later. One question that's important for you to consider and to ask is this: what is your timeline for hiring in this position? Or when might I expect to hear from you? Most people, when they're doing their interviews, they do have a timeline in which they want to get the position filled. So asking that question is perfectly acceptable, and this will give you also an idea of when you might hear something back from them. Just a couple points about closure. As you're closing out your interview time, it's really important to thank the person that is interviewing you for their time, taking moments to visit with you and to consider you for the position. That's really critical. Make sure that you have all of your belongings when you leave, your coat, your purse. Hopefully your phone is in your purse or in your coat pocket in the case of gentlemen. Wait until you're out of the organization and off their campus before you make that celebratory call. It might be fun to quick text that person that's been waiting to hear how it went, but make sure that you're away from the area when you do make that call. And lastly but not least, write a personal handwritten thank you note to the person that took the time to interview and mail it the day after the interview. Not many of us get handwritten notes anymore, and it's very impressive when you receive that handwritten note. And I would dare say it would give you an edge up on the competition. So now you have the job. What now? You're super excited, you're ready for your first day, but what are some things that you should really think about now that you have the job? First of all, prepare for that first day. Know where you need to show up, what time you need to show up, where you should park, where you need to punch in if that's part of your process, the name of the person, the floor or the room that you're going to, if you have a locker assigned to you. All of those things are important things to know before you arrive. Also, consider the dress code. Are you dressed appropriately for the first day? That's important to find out as well. When you arrive for that first day, of course you're going to be nervous and excited. That's completely normal. In your interview process, hopefully you asked a question about orientation and what you might expect for orientation and who might be doing that for you. At our organization here at Cambridge Medical Center, we have mentors or preceptors that we match our new employees with. They will be with them from their first day, and depending on the position, they might be with them anywhere from 2 weeks all the way up to 6 weeks or more, depending on the level of training and orientation for the position. During that time, there are typically checklists that are gone over with regards to the position. And then having that as a guide for each day, you can look to see what you've done that day as far as orientation and also set goals for tomorrow. Ask questions. Don't be afraid to ask questions. There really are no stupid questions when you get into a new role. Don't feel like you have to know it all right away. That's what you're in orientation for. And if you feel like you're confused or you're overwhelmed, that you're not getting it maybe completely, that's okay too. Go ahead and talk with your preceptor or mentor, or even your manager, and ask for clarification. We would much rather you stop us and ask for clarification than go along with it and then be very stressed out. Coming to a new job is overwhelming. It's also exciting. It also can be stressful. So making sure that you're taking that step back and allowing time to ask those questions is important. Just a note about cell phone use. One of the things that's really important, particularly in healthcare, is that our cell phones are turned off, stowed away, and are only accessed as appropriate on breaks or after work. As you can imagine, confidentiality and HIPAA laws are really important in our business as healthcare, and we are not allowed to be talking about anything that we see or do at our jobs, and absolutely no pictures. So that's something to be checking on as you get into your new position as well. What are the policies and procedures around cell phone use and also social media?
When patients are in a hospital, they become conservative regarding who's taking care of them. Visible tattoos and piercings, other than pierced ears, aren't allowed at Burnett Medical Center. If an employee has them, they need to be covered. Thousands of people die each year from influenza, and it's the job of healthcare to heal patients and do no harm. So next flu season, we're requiring all employees to receive influenza immunization. All immunization records need to be documented in your medical file, and if certain ones are missing, you would need to have blood drawn for a titer to verify your immunity.
As a new employee in the workplace, it's critically important that you align yourself with people that are positive influences. In any organization, you will find people that might cut corners, they might have a poor attitude, they might not really like coming to work anymore, they might be burnt out. So avoiding those types of people right away as a new employee is critically important. These are the types of people that are going to tell you that you're doing it wrong, or you're the new person and you don't get how things are done here. So finding those people to associate with, to have lunch with, to have breaks with, to learn from are very important. Most often those that are mentors or preceptors are going to be those positive influences in the workplace. So finding those people and really learning from them, their years of experience, what has worked well for them, how do they find to do it best? And in our organization, we train our preceptors and mentors to really teach it by the book. Teach the process, the policy, really by the book. And as you go along, you might learn ways of being more efficient, but not cutting corners. So associate with those types of people. The other thing to do in your new position is to find out a little bit more about the culture of that workplace. That is any unwritten rules in the unit or the department or the floor that you're working on. Maybe there's someone that you shouldn't talk to before they have their first cup of coffee in the morning. Those are the kinds of things that you're not going to know as a new person coming in. So find out. Maybe a certain person is allergic to significant perfume or other scents, and then you come with more cologne on than you should. Those are some important things to find out about. The unwritten rules, the things that are not in the orientation checklist or the orientation manual. Ask those questions. Some organizations or companies, after their initial orientation, will have a 30-day check-in, 60-day, 90-day, and a 1-year, perhaps, check-in. Be comfortable with that and be ready to share your insights, your experiences, your frustrations with what has gone on during that 30, 60, 90 days. I want to encourage you to stick with it again, because starting a new job is very stressful. It's exciting, but it's also stressful. So it's important to find someone that that's your go-to person, someone that you trust, someone that you can talk to, and you know they will not share what you are sharing with them. So that might be somebody outside of your work environment. That's okay, but have that person in your life that you can talk to, because there are various stages. As you begin your new job, it's like being in a honeymoon phase and you're super excited about this job. And then perhaps a month later, 2 months later, you get into reality shock. And it's like, what did I get myself into? And it's at that point where hopefully your preceptor or mentor that's working alongside you, perhaps it's your manager, or it's that go-to person that you have in your life. They will encourage you at that point when you've maybe hit reality shock and you're thinking, oh, I don't know if I can stick this out. I don't know if I can stay here. I don't know if this is the right fit for me. Just know that all of those questions are completely normal. Each person goes through those stages at different times, but just know that it's normal. And I want to encourage you to stick it out because it is worth it. Give yourself at least a year to adjust to the work environment, to find out what works for you, where your niche is, and to really learn the scope of the job.